Today's Elko Live features excerpts from the recent Elko County Health Board meeting held in conjunction with the Elko County Commission session. The following are edited portions of the entire meeting, which ran more than an hour in length. The meeting is chaired by Dr. Bryce Putnam, Elko County Public Health Officer. In today's program, you'll hear from representatives from Great Basin College, Northeastern Nevada Regional Hospital, the Great Basin Children's Advocacy Center, and the Elko County Sheriff's Office. There are important health updates on COVID and flu and a year-end report on overdose and suicide.
For the record, Dr. Amber Danelli. I am currently the Associate Vice President at Great Basin College, but will transfer into the interim presidency in July, which I'm very excited for. I'm here today to talk to you guys about our COVID numbers because we still have a COVID tracing team that works in partnership. And as you were saying, we used to run 4 counties, now we run 3 because Eureka has now joined an alliance with Carson. Yeah. So we have Lander, Humboldt, and Elko. And today I'll be reporting just on our Elko numbers, and we'll look at the last quarter, which is October, November, December. So we've had, these are documented cases. These are people that actually they're ill enough to go get testing at a clinic or a hospital. So we've had 398 cases that have done that. I'm going to give you some different age ranges just so you have a better idea of who those cases are that are seeking medical attention. So on ages 0 to 4, we've had 14. That school age is 5 to 17 years old. We've had 53. Our age range of 18 to 29, 77. Our highest age range, or our highest numbers are in the age range of age 30 to 49, and there are 106. Age 50 to 69 have been 90, and age 70 plus have been 56. And then we had 2 that didn't identify their age, which happens sometimes. So the next question that we frequently get from people is, out of those people, how many have been vaccinated? So we track that as well, although people do not have to report it. So we would let you know that 129 of those individuals were vaccinated, 140 were not, and 129 indicated that they did not want to share that information one way or another. So there's no real way for us to give you any significant data on that, but we do collect it. Our next category that we talk about is going to be hospitalizations. So those are the patients that we follow more closely. We make sure that how long they're in the hospital. The average is anywhere from 2 to 3 days. The majority of those patients do require oxygen. I would tell you 95% of them are reported to be on some sort of oxygen. But by the time they leave the hospital, only 30% of them are leaving on some sort of oxygen. The majority of those patients that are hospitalized are over the age of 55. So it's pretty rare that we see any of our school-age children that are hospitalized. And when we do see that, we see it in conjunction with patients that not only test positive for COVID, but also have influenza A and B. And sometimes they have COVID, influenza A, and B at the same time. So that's somewhat significant in the fact that we know that people can have multiple viruses at any given time. And so it makes it harder for us to tell which one of those viruses is impacting those patients the greatest. We haven't had any patients die for several months. I think it's greater than 8 months, which is fantastic. And the last patient that we did have pass away was over the age of 90. So we're making some gains there. The places that we track.
Amber,
Sure.
I know you 100% don't know, but do you guess that that's better treatment, or is that a COVID that's not as aggressive, or what's your gut telling you, or your background assessment?
I would say that the information that we're getting from public health is that this strain of the virus is not as deadly. It doesn't affect the system quite as heavily, like the lung capacity and things like that, but we still see that impacting our care centers. So we track anything that has greater than 10 positive COVID patients in a given 10-day rolling period. So on if you're looking at the beginning of the month to the 10th day of the month, if we have more than 10 people positive in, say, a care center or a school setting, jail, correctional facility that's even just like an interim. They have a facility that's kind of like that in Winnemucca. We work with them as well. So anytime we see those rolling positives like that, we know that usually especially in corrections or jails, it's usually the staff that are bringing the COVID in. But even those cases are pretty mild, and we're not seeing any need for hospitalization or things like that. In the care center, we do see patients that will end up with hospitalizations. And like I said, we have several different care centers because we also look at these other counties. And most of the time with those patients, I would tell you that they have, as we age, we are more compromised and we have other things that are going on. So they have a tendency to, when they get COVID, if they already have something else going on, they're already compromised. And when they go to the hospital, they're not being just treated for the COVID, but they also have other comorbidities that are also impacting their stay.
Does the data indicate that the population is more immune to those early strains of COVID-19?
Well, we have different strains of COVID. We have, Dr. Putnam could tell you, we have so many different iterations of the virus at this point. Every time they send us yet another update of here is another strain. So basically what we watch for and what we talk to Dr. Putnam about frequently is who's being compromised. And so what we've seen in the beginning is that we knew elderly were more compromised. They're going to continue to be a little bit more compromised because of those comorbidities. And then we saw, for a little while, we saw some school-age children that we saw more rapidly spread, but it was also because the virus was becoming more transmissible. Between school-age children, they're less likely to, wash their hands. And so we also know that we see more transmission in high school students that are involved in sports sometimes because of the hand contact. So there's so many different variables with COVID that it would be really difficult, even though this is one of the reasons why they're still tracking it. They're still learning about it. They're still trying to understand how it's going to continue to evolve and how we're going to react to that as a society. So as long as we know we have resources, and that's another thing that our team does when patients are released or when we have somebody who's home with COVID, making sure that we're working with the county to make sure that if that's, they live alone, they're elderly, that they have groceries. And so the county's been really good about working with us with that. And that's pretty much it in a nutshell.
Thank you. Thank you, Amber. I just wanted to say from me, as not only you're someone who's worked so closely with over the past 3 years, but true congratulations on your promotion to be an interim president. I don't think they could have found anyone better. And what you've done for this county, for this state, for all of us, and the countless hours that you and your team have done in working closely with all of us, I couldn't thank you enough if I tried. And we're all in debt to you and your team for everything that they've done. And just thank you so much for all of your accomplishments and the late nights without a lot of recognition, and you continue to do it. So thank you so much for everything you've done.
Well, it's really been an honor to work with everybody. And unfortunately, it's with COVID, but it really did give me an opportunity to really pull these different, Winnemucca is fantastic too, as is Lander, and Eureka's been wonderful to work with. So it really says a lot about our counties. And again, thank you.
Thank you, Anna.
Thanks, Amber. Thanks. And I think that this is a transition into what Amy had said too, because we have these communicable diseases and the programs and the grant funding that Amber has done is not going to be around forever. And I would love for it to be doing it, but I trust Amber and I trust her team that we're getting the right information. But in the next 6 months into the next year, are we going to be getting that information? And the answer is, I don't know. And that's why, we want to make sure that we're having these conversations about moving forward. How do we find the information, and will we have those? And will we have someone like Amber being there that we can talk to and to be able to present to us and to know exactly what's going on? Because I can say it, But sometimes, before this, it was hard for me to get information. And with Amber and her team, it's just been just a wonderful transition. And we've gotten used to that kind of service. And it's going to be hard to see her leave because she doesn't just take care of COVID. Their team takes care of everything, and they've graciously just accepted that role, and it's been so nice. So thank you to you and your team, and we will move on to agenda item I, Northeastern Nevada Regional Hospital, presentation on the latest quality scorecard for the hospital and updates of any outbreaks, activities of the emergency department, recruitment efforts, staffing status, and quality scorecard relative to patient satisfaction and outcomes, emergency flights, community events, and other updates of community interest. Welcome.
Thank you. Steve Simpson, for the record. I'm the administrator at Northeastern Nevada Regional Hospital. I wanted to also give you an update. I think some of you may have the handout, and I think it's also within the presentation, of some of our communicable diseases that we're seeing within the hospital as well. It's sort of a trend we're having. Just a quick update of what the data is that you're looking at. This data includes all the patients tested, whether they were treated in our ER, admitted as an inpatient, or seen at an offsite clinic. This is all tests that have come through our lab in these 4 areas, which include COVID-19, influenza A, flu B, and RSV. This data does not reflect how sick these patients were, merely that they were tested positive. What the chart makes very clear is we've seen considerably fewer patients testing positive for COVID-19, as Amber has represented. Also, fewer influenza A and RSV so far this cold season, at least that is being tested in our facility. COVID is down 85 patients. Influenza A is down by 191 and RSV by 190, and that's all very good news. What's not quite as positive or as optimistic is the increase in flu B. Whereas we didn't see any cases of this type of flu in the first half of last flu season, we've already seen 47 cases this time of year. Our CNO, Becky Jones, commented that it is rare to see both influenza A and B circulating at the same time, which is what we're definitely seeing this year. While flu A is generally more likely to cause severe symptoms, both types of flu can be life-threatening for at-risk individuals. And we have seen patients with both flu types admitted to the hospital with acute sicknesses as well. All that to be said, we are still in the middle of flu season. We encourage everyone to take the precautions necessary, like covering your cough and washing your hands frequently. Flu shots are still available and still effective as we face another 3 to 4 months of flu season. So we hope that everyone stays healthy and safe. Okay, update on a couple of service lines. One of the key service lines that we have at our hospital is our cardiovascular services. As you know, we routinely provide life-saving interventions in our cardiac cath lab. Over the last year, we've relied on a number of rotating interventional cardiologists to provide coverage, including Dr. Mallory and Dr. Adan. We're very grateful for these doctors who continue to come in from out of town and will continue to utilize their services. I'm happy to announce that we've also signed a contract with Dr. Jershin Valdez to join our staff full-time. Dr. Valdez is a seasoned interventional cardiologist currently practicing in Kentucky who will be moving to Elko later this spring full-time, which is awesome. I will say, and it's not in my notes, that we have an additional interventional cardiologist that we are in contract with is now to provide full-time services as well. So again, these are docs who are going to be spending the majority of their time in Elko, spending their money in this community, which we're excited to have them here. Behavioral health. We'll talk a little bit about that. I want to mention where we are. As you know, we've been working toward opening the inpatient unit on the 3rd floor of the hospital. The goal is to admit our first patients before the end of the year. I know that's not what you wanted to hear. You hear it opening next week, but you'll take it before the end of the year. With that in view, we've begun the licensure process with the state of Nevada. I'm not going to bore you with all the details, but one thing we've determined that we've learned through the process, I've announced that it's going to be a 16-bed unit, and we've previously announced that it would be a 12-bed adult with an additional 4 beds geriatric. We're actually shifting that to what they call a distinct part unit or a DPU, and this means we have flexibility to fluctuate with what our needs are within those beds as well. So it's not identified as only 4 for geriatric. If we needed to use 11, we could use 11 and 1 and vice versa. So that's what a DPU allows for us to do within the facility, and that will give us the flexibility we need to meet whatever needs we have. Again, we really truly want to ensure that this BHU, Behavioral Health Unit, serves our community, so it's important that we plan this out correctly, and we'll keep you apprised as our licensure moves forward with the state. And again, I don't know this for sure, but there may be an opportunity for a few of you to join me in either welcoming them when they come tour, help me knock down a wall or two if we need to do that as well. We'd like for you to participate, as this is truly a community initiative.
Okay, we will move on to agenda item K, Great Basin Children's Advocacy Center. Presentation on the service provided by the Great Basin Children's Advocacy Center. And this is a non-action item. Welcome and thanks for being here and staying with us, Tyler.
Thank you. Tyler Ingram, Elko County DA. I'm with Tanya Yell, also from the DA's office. As many of you know, we are now fully operational. We have been for a few months now. By fully operational, that means that we are now providing forensic interviews at the CAC. We can provide medical examinations at the CAC for both adult victims and children victims, although the child victims are the focus. We do have law enforcement presence in the building during the week, and the sheriff has dedicated at this time at least one detective who is there full-time. The police department had 2 detectives working out of there. One just retired early or late last week, I guess. So now there are 2 full-time detectives working out of that building, which is wonderful. Again, I usually say this, but one of the things that I'm most proud of is that we have on-site mental health counseling for children, and they are currently providing those services out of the CAC. They're on site 4 days a week for 5 hours, and those services are free to the children and the children's family. So it's been a huge benefit already. We've seen one of the coolest stories, I think, is there's a particular child who receives counseling there that wants to do her counseling sessions out on the playground, which most of you have seen. That's where she feels most comfortable, so they've adapted and do those services out there. That's pretty cool to see. We recently, most of you on the board, just approved 2 grants that were awarded to us. So thank you to Abby, who's no longer here, but also to Megan, who have been working on getting those grants implemented. Those grants will pay for that Spanish-speaking forensic interviewer, which will be a huge benefit to our community. Those grants will also pay for forensic interviewers. Previously, we had a county employee doing those forensic interviews, which is not best practice, but now we can pay independent third-party interviewers to do that. And the victim advocate portion of that is huge because we had been running for the last few months largely without any sort of victim advocates. And I recall going in front of the commission, asking for your support to go forward with building this facility. And we told you that I wouldn't be asking for general funds because we have been running this grant funded. And so far, our grants department has made sure that has happened. So it's been good so far, but no promises that I'm not going to come before the commission.
I just say thank you. And this is just a wonderful, wonderful, facility. I've got to see it from the outside. I haven't been on the inside. Definitely want to do that. But to see that kids can get taken care of and that you are all a part of it, and knowing you and how insightful you are and that you care for this community as much as you do in this county. Just all of you, we appreciate everything you do, and for the families that come in, they do as well. So thank you for your services.
Thank you.
Thank you, Bryce. I just thought of something, I'm sorry. Tanya Yell with the District Attorney's Office in Great Basin Children's Advocacy Center. One of the other reasons why we wanted to appear before this body was to create an avenue to maybe reach out to the health board in Lander County so that we can start developing more of a partnership with that area that we have with the other sister counties that we cover for the Advocacy Center as well.
Great. Thank you.
Okay, I've got a
Real
question.
quick, if you don't mind. We have noticed that when we're applying for these grants, one of the things that these grants require is collaboration between other entities. And I think that this board is an excellent opportunity for us to reach out to Nevada Health Centers, the hospital, any of those other entities that have spoke today, and try to come up with ideas where we can collaborate and potentially become eligible for more grant funds for children.
Absolutely, and that's something that we certainly would be welcome to reaching out to any of us, and even if I have to quarterback that for you, I'd be happy to do that.
Thank you.
So thank you.
Got a question. I know the center is relatively new, but have you seen improved outcomes in certain cases? I know you can't cite specific cases, but in general, what type of improved outcomes have you seen because of this project?
Well, I think because we are so new and we were operating as a multidisciplinary team for a lot of years before this, that I can't say we've seen a noticeable difference like in prosecutions or anything. But what I have noticed, and probably Tanya's noticed more than I have, is just the comfort level of the family and the children when they come into the facility versus going to the police department for that forensic interview or having to go to a hospital initially because they've been sexually assaulted. So just that comfort level has already made, in my opinion, the $4-point-something million completely worth it.
100% agree.
I was
Any other-
hoping you said you hadn't had to use anything yet, but
We have. I think one of our forensic interviewers has already done, what was it, Tanya, like 22?
Since we got in the building, yeah, the first one happened in
Unbelievable.
October. So
yeah, once again, I'd rather you just say, nope, it's actually been vacant, you hadn't to do anything, but that's not the case.
We're going to shut it down. Yeah.
I wish we could shut it down, absolutely. I want to work ourselves out of business.
Yeah, it's definitely a double-edged sword. We're glad for the services. We hate to see it, though. But I totally agree to be able to be in the worst situation of your life and being able to have a wonderful facility with great people, and for you not to go to a police station or to the hospital where things are very intimidating. I think that's the environment that these families and children definitely deserve.
Well, Great Basin Children's Advocacy Center also provides a focal point for the entire state. I mean, we're the newest development of the 4 CACs that are in the state of Nevada, and we are definitely the most beautiful. So they are using that for advertisements as far as in the state of Nevada and also in their national programs so we get to have that exposure.
Thank you.
Amazing facility.
Thank you.
Lieutenant Doug Fisher of the Sheriff's Office for the Operations Division. Appreciate you bringing us in here tonight. As far as coroner-related and suicides and overdoses, we did see a reduction of about 20 cases this last year in our coroner cases. We had 167 overall cases that we investigated, so we were down 20 from the previous year, which is a pretty good downtrend. Because the previous year in 21 we were at 176, so we've doing well there. As far as our suicides, suicides went up about 5. They're at 19 this last year. Again, in trending this, it looks like a kind of a cyclic behavior. One year we're down and the next year we're kind of up. Post-COVID, we were at the highest, which is 26. So still kind of concerning number. And when I was literally looking at the suicide numbers this year, something that stuck out to me was the age. The age was a lot higher than I remembered it, and I ran the average for the age of the 19, and it was 51 and a half years of age. Well, I kind of went back a little bit into that and kind of looked at some of the cases, and many of those, our elders had underlying health issues, and they potentially turned to suicide in that. So it was just kind of something that stuck out when I was reviewing these cases and looking at these statistics that kind of caught my attention this year. As far as the modality, firearm is still our number one by far. 71 of our 95 cases are firearm related for suicides. Second is the hanging, and then medical toxicity is number 3, which is the overdose of potential medications that they have or of certain drugs that they have prescribed to them. By sex, male half, male population is by far the largest one at 76, of the 95, 19 of them are female. As far as overdose, One thing that I see our trend is going down a little bit in 23. We're tracking at 11 right now that we know that are overdose deaths. We have a few more that we do not have autopsy reports in, and we won't have those in for a few more months before I can finalize those out to see if our investigations were accurate, or we've ran into a couple cases in 22 that I pointed to what we thought was an overdose death, and it was not. It was actually a natural death. So we'll continue to track those. There's about 4 cases that I know of that we're really looking at heavy. So my estimated number would be about 15 is where I think we're going to come in. But I'm going to wait till the investigation results come back.
I'm actually surprised with fentanyl and all that it's not higher, to be honest with you.
Well, it is there, but we had 2 alcohol deaths, and everything else had a fentanyl nexus. So fentanyl hydrocodone, fentanyl methamphetamines, fentanyl heroin, and cocaine. So of the 11 that we reported, 2 of them are alcohol, the rest of them were fentanyl related. At least had one component of the nexus of the overdose. So fentanyl is still a big portion of our overdose deaths. I'm hoping that this last year, the Narcotics Task Force and the state and them all have been working pretty hard on some of our larger drug dealers in town, and they've put some pretty big cases forth for Tyler to prosecute, and hopefully that's potentially put a little dent in the supply that we have around here. So I'm hoping that trend stays that way.
Deputy, how do you tell, and can you, maybe you can't, can you tell a difference between an overdose and suicide?
Usually in the overdose, you'll have the drugs available for you. You'll see the paraphernalia, the burnt foil, the pipes. Long time, you might even know that they're a long-time user because they frequent us that much. And as far as determining if it's a suicide or an overdose, we really look at the communications that they may have put out just prior to or the days prior to what their mental health was, and they're sharing with their family, their friends. It could be social media that they actually put that out there. So we look at that to try to make the determination if it's actually an overdose or if it's a suicide.
Thanks.
One quick thing. So, I mentioned this last time, and I think it's worth mentioning again. When I see these things laced with fentanyl, there is no doubt in my mind that there is criminal intent involved in that lacing. And I think we need to figure out a way to start calling that murder as opposed to an overdose, because that's what it is. They're poisoning people. I mean, if someone put rat poison in that and they died by rat, that would be poisoning. And I see fentanyl laced products in the same light. So I say that only to, get that started as a conversation in the community, because I think we need to do that.
Don't want to bring you up to speed on that. We already had that conversation with Tyler. Tyler's been a very, very advocate of that, and we are already looking at that. We've been looking at that for about the last year. And if we can prove that case, that somebody's definitively been the supplier of known fentanyl, yes, we'll move forward on those cases. So that discussion's already there. Those cases are sometimes tough, but we're definitely going to go over that hurdle as many times as we can to go after those ones that are putting this fentanyl out there and causing these deaths. Any other questions?
Is that usually the local guys adding fentanyl, or is that way back to the Mexico and cutting it there?
That's the supplier, Mexico, overseas, wherever it's coming in. They usually, we get blues, little blue tablets that have fentanyl and some cut is what they have, and you never know what it is. So it's pressed overseas or in a big lab. You don't normally see us mixing it, but every once in a while you will. It's kind of a one-off if you have it here.
Okay.
Any other questions?
Thank you, sir.
Thank you. Appreciate it.
Thank you.
Thank you for listening to today's Elko Live. Find the entire Elko County Health Board meeting online at elkocountynv.net. You've been listening to excerpts from the January 17th meeting.